Good evening. I am Nadine Carty-Keynes, and thank you for joining us at the Nevis Emergency Operations Center, EOC, today, Monday, 21st of September 2020, for an update on the situation regarding the novel coronavirus, COVID-19. I want to thank all of you for viewing, and I want to thank all our media houses that have joined us virtually. All questions, of course, will be taken at the end after all of our presenters would have presented. Just want to remind persons that the Nevis COVID-19 briefing will be aired on Mondays at 8:30 p.m. on Nevis Television. If you missed that, you can always follow up on the YouTube channel and Facebook pages of Nevis Television, Nevis HPU, Nevis NDMD, and of course on Von Radio every Tuesday at 1 p.m. I would like to take a moment to recognize today, Monday 21st September, as World Alzheimer's Day. And to commemorate that, we wear purple to show our support for persons who suffer from this disease and various forms of dementia. In this time of COVID, it's very important that we show support to persons who are suffering with mental challenges, persons who may have Alzheimer's or dementia, to help to keep them safe, remind them of the procedures, the protocols, the preventative measures that are in place. This evening we have with us Mr. Brian Dyer, the Nevis EOC Director, Superintendent Lyndon David, responsible for the Nevis Division of the Royal St. Kitts and Nevis Police Force, Dr. Judy Nisbet, Chair of the Nevis COVID-19 Taskforce, and we have with us Mr. John Hanley, Permanent Secretary in the Ministry of Tourism, and Ms. Zanella Claxton, Principal Education Officer in the Department of Education, Ministry of Education. I say welcome to all our presenters, and without further ado, I'd like to welcome Mr. Brian Dyer, who will provide his updates.
Good evening. We start as usual with some weather information. The tropical weather discussion for the North America, Central America, Gulf of Mexico, Caribbean Sea, and northern section of the South America and the Atlantic Ocean. Special weather features. At this time, we have a quiet Atlantic. As you can see, there's no tropical cyclone approaching the islands. Tropical cyclone Wilma, who was there a few hours ago, has dissipated as a result of dry air and wind shear. So the remnants of Wilma are currently centered near 16.0 degrees latitude, 49 west degrees latitude this morning, and are producing scattered to moderate convection within 60 nautical miles of the center. These remnants should fully dissipate later today, so it should not be a worry to us, as a few hours ago we were looking at a tropical weather system approaching the islands. However, Wilma has dissipated and is of no threat now to the islands. In the Caribbean Sea, in the Gulf of Mexico, we have tropical storm Beta. We have entered the Greek alphabet and we are now down to Beta. Again, we have exceeded the number of named storms for 2020, so we have now utilizing the Greek alphabet. So tropical storm Beta is centered near latitude 27.7 degrees north, 95.1 degrees west, or 80 miles east-southeast of Port O'Connor, Texas, moving west at 5 knots. Estimated minimal central pressure 996 millibars. Maximum sustained winds 45 knots, gusting to 55 knots. Scattered to moderate convection are within 316 nautical miles of the center. We move on to Hurricane Teddy, who is approaching the southeast of Bermuda. Its current position 30.3 degrees north, 63.2 degrees west, or 140 miles to the southeast of Bermuda, moving north at 8 knots. Estimated minimum central pressure 963 millibars. Maximum sustained winds 85 knots, gusting to 105 knots. And still hanging on, post-tropical cyclone Paulette has entered some cold waters, and it's approaching the South Azores on its way to Europe, and that should provide them with some stormy weather for the rest of this week. All right, that's it for the weather information. I now turn to the information from the Compliance Task Force, who has been inspecting some of the schools since the schools have been reopened. Government preschools, they have inspected 5, private preschools 6, home-based nurseries 8, government primary schools 6, private primary schools 3, government secondary schools 2, private secondary schools 1, college 1, and special education 1. Private educational institutions 5, grand total of 37. So I just want to continue to appeal to our general public to wear a mask and to be vigilant as you go about and obey the rules of the COVID-19 SRO number 39. Thank you very much.
Thank you, Mr. Dyer. I'd now like to welcome Superintendent David as he will provide his updates for us here on Nevis.
Thank you very much, Nadine. Good evening, all. I say we'll just give some stats. However, a number of our stats have not moved, or some just moved just by 1 digit. Thus far, we have conducted 1,768 foot and mobile patrols, 152 vehicle checkpoints, 78 arrests were made and 10 persons have been charged, 27 crimes reported and 17 arrests. We had 9,251 vehicles stopped, 26 persons were informed that they will be summoned. As I mentioned earlier, you realize that the figures didn't change much during this period because of other activities we were undertaking. Just reminding our school children to continue to wear their face mask in public places, and I encourage parents and teachers to assist us in ensuring that our children are utilizing the mask correctly and at all times in a public place. All are reminded that all private parties, beach parties and picnics, we have banquets, balls, receptions are still restricted. Any other ceremony in any facility or public place, meeting or fraternal society, private or social club or civic association or organization, any other type of social event are deemed restricted activities. However, as mentioned before, based on our regulations, an application can be made to the Chief of Police in consultation with the COVID Task Force, and approval may be given or you may be denied of that activity. Having said that, we are realizing that there are a number of persons who have applied for permission to host various events, large and small. Some of you are keeping the necessary guidance in and the restrictions that you were given, and yet there are still some who are not following the instructions given. Therefore, we will be doing things differently to ensure that previous shortcomings do not reoccur. So we are saying to persons, once you would have indicated to the authorities that you are going to do something, you must do that, or else you will be denied. And during the process, permission will be withdrawn. And we do not want to have that where you have patrons patronizing whatever activity you're having to ask to remove themselves from that location. So we are saying to everyone, comply. There were many events which were allowed to take place during the run-up of our opening of our borders. And these are just to test not just the police and the health services capability, but also the citizens' response to their responsibility in terms of ensuring that we have no spread of COVID-19 in our federation. Yes, we have seen cases. I know that we have 2 new cases, But we are saying to persons that once you're not complying with this, when we open up, you realize what will happen. So we're saying, take the best of these occasions that are allowed to you, as opposed to misuse them. And we have seen that. That has taken place, and we have taken note, and as I mentioned earlier, we are rethinking our position, and realizing that there were some shortcomings, we will improve on them. So it's not just the police, the government, and other essential services, health, and disaster, but it's all of us who must take this responsibility to ensure our individual approach is one that will prevent the spread of COVID, or contracting COVID, and pass it on to someone. We have seen where other countries would have made an effort to give their citizens that little leverage to move about freely and participate in varying activities, and they had to revert and close down. We have seen Israel recently opened up, and they've gone back down into full lockdown. We do not want to go back to that situation, so we are saying to persons, look at what we are trying to do to ensure that you continue to enjoy your lives as usual. I encourage our sporting bodies to continue to follow the protocols when it comes to training and practicing sessions. And you know you also have the permission to have some matches, practice matches. So ensure that you do that whilst the players are on the field. So in closing, I take this opportunity to thank God for his continued mercies and blessings on the Federation of St. Kitts and Nevis, and that he continued to, not only in COVID, but as Mr. Brian Dyer was explaining about the weather condition that save us the destruction of weather conditions. Thank our governments, both local and federal, for their support in so many different ways that they would have given support, whether it's legislation or finance, they have given that. We thank our medical staff to continue to be out there in the front line to ensure that persons are being tested and other things, and working in the quarantine sites, and if persons contract, continue to give medication. Our disaster staff continue to assist in terms of the quarantine sites, taking items to and from, and ensuring persons are traveling to and from, in and out of the sites. Other essential workers, we are saying to you, thank you very much. And our media, we are saying to you, thank you for help sending the message out. And also, when we see things on your media, it tells us, look here, we have to go back to the drawing board and get certain things done. To the citizens who continue to support us, we're saying to you, continue to do so. We appreciate that you love the police, you love the authorities to ensure that we're keeping you safe. And to you, the violators, we're saying to you, remember, it's all of us in this. It's not something that you can block or punch against. It's something that will affect you daily, and we see the devastation that it has caused throughout the world. Thank you very much, and do enjoy the rest of the evening.
Thank you so much, Superintendent David. Now I'd like to welcome Dr. Judy Nesbitt, Chair of the Nevis COVID-19 Task Force.
Thank you, Madam Chair, and good evening to everyone. I'll start with the global statistics. The World Health Organization reports that as of today, Monday, 21st September, there have been over 30 million confirmed cases. 30,949,804 confirmed cases worldwide since the start of the epidemic. This is just over 2 million additional cases since I reported last Monday, and just over 272,000 in the last 24 hours. Deaths worldwide have risen to 959,116, with over 36,000 deaths occurring during the last week. From these figures, the deaths have slowed since my last report. Worldwide, the USA continues to lead in the number of confirmed cases with 6.7 million cases, followed by India with 5.5 million cases, and Brazil with 4.5 million cases. When the Public Health Agency reported on September 17th, there have been, since the onset of the pandemic, 197,351 cases. That is over 12,000 new cases over the last week in the 33 countries, areas, and territories of the Caribbean. 112,914 persons have recovered from COVID-19 in the Caribbean region, while there have been 3,457 deaths since the start of the epidemic. On Nevis, we have recorded 2 additional cases of COVID-19, bringing the total number of cases recorded to 6. These are citizens repatriated to Nevis and are doing well with very mild symptoms. There are therefore 2 active cases in isolation, 4 cases fully recovered with no deaths. We have tested so far 369 persons since the onset of the pandemic, with 363 being negative, and we have no pending results. 380 persons have been released from quarantine, and currently there are 20 persons in mandatory quarantine, as I have said before, 2 persons in isolation. In the Federation, then, we have a total of 19 cases of COVID-19 with 17 recoveries, no deaths, and 2 persons in isolation. We continue to repatriate citizens, and to date we have repatriated 180 persons over a period of 144 days, and we have released 158 persons from quarantine since we started repatriation. So we continue to quarantine all persons entering St. Kitts and Nevis. Persons traveling may have been in contact with persons with COVID-19 before travel or during travel in airports, on aircrafts, etc. There's a mandatory quarantine period of 14 days on arrival. So why 14 days? The incubation period for COVID-19, which is the time between exposure to the virus and symptom onset, is on average 5 to 6 days, but can be as long as 14 days. So this is why we quarantine persons for 14 days, because it may take 14 days for persons to show symptoms. Quarantine keeps someone who might have been exposed to the virus away from others. So who else may be quarantined besides persons who have traveled? That would be anyone who has been in contact with someone who has COVID-19, even here on island. So someone who has been in close contact with someone who has COVID-19. So who is considered a close contact? You are considered a close contact if you were within 6 feet of someone who has COVID-19 for a total of 15 minutes or more. You provided care at home for someone who is sick with COVID-19. You are a healthcare provider who has administered care and not outfitted in personal protective equipment, such as your gloves, your mask, your gown, etc. You're a close contact if you had direct physical contact with someone, with a person who is sick. That is, you've hugged or kissed them, for example, shaken their hands. You are considered a close contact if you have shared eating or drinking utensils, or the person has sneezed, coughed, or somehow got respiratory droplets on you. Persons while in quarantine are asked to watch for fever. That is a temperature of 100.4 degrees Fahrenheit or higher. Watch for cough, shortness of breath, or other symptoms of COVID-19. And persons in quarantine are also asked to stay away from others, especially persons who are at higher risk of getting very sick from COVID-19, such as persons with chronic illnesses. So this is why in our quarantine sites, each person or family is given their own quarters and not allowed to mingle with others, because persons in quarantine need to keep to themselves and stay away from other persons. On day 14 of quarantine, a person is tested. The person who is in quarantine is tested. And if the RT-PCR test is negative, that person can leave quarantine and reintegrate into society. So we have spoken a bit about quarantine. Now, isolation, on the other hand, keeps someone who is infected with the virus away from others. So a person who is in isolation is a person who is infected with the virus and should keep away from others. Persons who are in isolation should stay at home or at the quarantine site or at the isolation site or other designated area until it's safe for them to be around others. If that person is in the home, and that's not the case now necessarily at this time because we are quarantining people in government facilities, but if the person gets sick here on Nevis and they're within the home, anyone sick or infected should separate themselves from others by staying in a specific sick room, we call a sick room, or in a specific room or area, and use a separate bathroom if that is available. So who should isolate? Of course, a person who has symptoms of COVID-19 or a person who has been diagnosed with COVID-19, and persons who have no symptoms but have tested positive for COVID-19 should isolate themselves. So persons with symptoms of COVID-19, persons who have been diagnosed with COVID-19, and persons who have been diagnosed with COVID-19 but have no symptoms, they ought to isolate themselves from others. What are some of the steps that you should take during isolation? You need to monitor your symptoms, and if the symptoms are getting worse, including trouble breathing or etc., seek medical care immediately by calling your healthcare provider and not just showing up at the healthcare provider. You stay in a separate room from others in the household. Use a separate bathroom if possible. Avoid contact with other members of the household. Don't share personal household items such as cups, towels, utensils, and wear a mask when you're around other persons. A healthcare provider will then decide when you are able to leave isolation. So I thought I would just go over this. We haven't spoken about quarantine or isolation for a while. So I thought I'll just go over quarantine and isolation. Thank you.
Thank you, Dr. Judy Nesbitt. I'd now like to welcome Ms. Zanella Claxton, Principal Education Officer in the Department of Education.
Good evening. The Department of Education takes this opportunity to thank all of our stakeholders, our school leaders, staff, students, and parents for adhering to the protocols as we continue to support and set examples for our students, and we endeavor to keep them safe. Candidates who sat the July-August sitting of the CXC examinations are asked to take note that the results will be available on Tuesday, 22nd September at 5 p.m. In order to access the results, students should go to the student portal, enter their candidate number and their last names, and they will be able to click or log in to the portal. Once again, results will become available at 5 p.m. on Tuesday, 22nd September 2020. Additionally, the Department of Education wishes to remind parents of the early dismissal of public schools every Wednesday during Term 1. The adjustment will take effect on Wednesday, 23rd September 2020, and will be implemented as follows. All public primary schools will dismiss at 2 p.m. The Gingerland Secondary School will dismiss at 3:20 p.m. The Charlestown Secondary School will not have an early dismissal and will dismiss at its usual time. The public preschools will also have an early dismissal, and parents are asked to collect their children by 2 p.m. Why do we have this early dismissal? The early dismissal of schools will facilitate staff development and training. Schools may also use this time to host their staff meetings. Early dismissal will therefore minimize the number of unscheduled interruptions to teaching time. In the past, schools would have several half-days or full days for staff development. On those days, students would be expected to remain at home. Additionally, schools would have several staff meetings, and on occasions, teachers would have to go off-site to attend workshops. In light of the COVID-19 protocols, this would not be accommodated any longer, as teachers have to be present to monitor their classrooms while classes are in sessions. As a result, parents are expected to support this initiative and to collect their students or make arrangements for their children to be collected from the school premises as soon as school is dismissed. The school buses will be on hand to collect students who travel via the buses. We continue to crave your support, parents and general community, as we continue in our efforts to protect our school community against the COVID-19 pandemic. Thank you once again, and we encourage everyone affiliated with schools to continue to observe protocols.
Thank you, Ms. Claxton, for your updates. Our final presenter is Mr. John Hanley, and he will bring his update from the Ministry of Tourism.
Yes, good evening, everyone. We bring you updates from the tourism sector in terms of our training, our recently concluded training that we would have had. We had our training in two phases. Phase one was sensitization training, which ran from July 27th to the 18th of August 2020 at NEPAC. And in that training, we had 1,300 participants engaged. We covered a number of sectors. Accommodation. In the accommodation sector, we covered hotels, guest houses, apartments, villas. In terms of tourism transport, we covered land taxis and water taxis. In terms of tour guides and activities, we covered tour guides, water sports, destination management companies. We also covered tourism, retail, and attractions. And in that segment, we dealt with artisan vendors, other vendors, attractions. And then we had tourism services, where we focused on the NTA, the Ministry of Tourism, port, immigration, customs, and security. And to remind, we engaged 1,300 persons in that training. The feedback was very positive, and most persons found the information imparted to be quite useful for the development of their own COVID-19 plans. And Some persons, though, gave us the feedback that they expected a more interactive format. Some told us that they found the information to be something they already knew, but the majority of persons found it useful. And even if there were a few persons who were aware of the information, we found it important to make sure that everyone in the sector was on the same page. We are thankful for the three entities that work together to bring about this training: the Ministry of Tourism, the Ministry of Health, and the Nevis Tourism Authority. And in my estimation, these entities worked together quite well to coordinate and execute this exercise. Phase 2 of the training, we call that Train the Trainer sessions, in which we invited persons from each tourism entity to attend the sessions, and then they in turn would go back to their establishments and pass on that information to other persons. We trained 294 persons, a maximum of 35 persons per session. The feedback was very positive. Persons left this session feeling more confident. The practical sessions were well received, and we had a number of activities, including the correct donning and doffing of personal protective equipment, mixing and cleaning of disinfecting solutions, cleaning of high-touch surfaces, hand-washing technique, vehicle cleaning technique, and proper bed linen removal and disinfection. So the practical sessions brought home the reality of the information being imparted and made it more relevant and practical. Draft protocols would have been proposed quite some time ago, and we are awaiting the ratification of these. So we have to, now that we have completed the training, there are some considerations. We promised to issue certificates to each participating establishment, and these will be issued. Well, as I said, we had 1,300 participants. So it is our intention to provide these certificates digitally, and only in cases where persons specifically request the hard copy of their certificate will we print those. So for the sensitization training, certificates will be issued to individuals, whereas for the trainer session, certificates will be issued to the actual establishments. The next phase that we are looking towards is the Travel Assured Seal. And this will be a federally issued document. We have been in collaboration with St. Kitts in terms of the template, so we are going to use something similar on both islands. So the Travel Assured Seal is going to be a twofold, it will have a twofold form. It will be a digital logo where qualifying establishments could attach it to their websites, social media platforms, etc. So there's a digital component, and there's a physical component, which would be either a decal, a sticker, or a certificate. And it can be displayed on the windscreen, your front office, or other prominent location. The validity of the seal would be 1 year. However, there would be constant monitoring of the establishments. So perhaps on a quarterly basis, they would be audited to make sure that they remain COVID compliant. So the Ministries of Health and Tourism will continue to collaborate with each other in terms of the auditing checklist, in terms of scheduling inspections for tourism entities, and in terms of actual inspections and the issuance of the seal. And we crave the cooperation and the understanding of all persons, and we expect everyone to be COVID compliant, so that whenever it is that our borders open, that we would be ready and capable of welcoming our visitors in a perfectly safe environment. Thank you.
Thank you so much, Mr. Hanley. I'd like to say thank you to all our presenters, and now we'll open for questions from our media persons if they have any questions to ask of our presenters. Shamika Budgin of Vaughan Radio. Why was the one in why was the 5-in-1 fete and other events that accommodated large gatherings approved by the task force? The numbers should be a limited number at these gatherings, as mentioned in recent months during previous COVID-19 briefings. So why is this going contrary to the proposed rules? Superintendent David.
Thank you very much for that question. I'll say to you that whenever the police will give permission for these activities to take place, normally you would have it in number. And as I mentioned in my opening remark, is that we realize that a number of promoters and persons who are carrying out these activities are not fully carrying out the requirement and the restrictions that were given. And as a result, we are rethinking, and there are a number of changes, significant changes that will be made. And I said also too that these, in my mind, were done in order to prepare ourselves for the opening up. And if we are seeing that persons are not willing to behave themselves correctly when we are open up to the world, well then more restrictions will come. And we understand that many people are concerned. Why it happened? But we are saying, persons wanted to get out, persons wanted to socialize in a way, but we expected that persons who organize these things to fully carry out what was instructed, the restrictions that were given. And having realizing that, we are rethinking, and there are some serious adjustments will be made to those things. So I will say to persons that you have indicated to us that when it comes to opening, we have work to do, and work we will do to protect our federation. So I want to thank you for that question, and I do hope that persons who will listen to me will make the necessary changes and adjustment and continue to follow the rules that are given.
Thank you, Superintendent David. Follow-up from Shamika Bajan for you. We're hearing this every week. When will we see these changes and restrictions being applied?
I will say to you, having had a discussion with the commissioner, effective immediately we will have these changes made. But I can say to you, in serious confirmation that in my division, that will take place. However, I know that the commissioner will stick to his word, and those other divisional officers and other senior officers will ensure that they too are uplifting the instruction given to us by our commanding officer. So therefore, we will continue to do so. And like I said, it's a work in progress, and we are saying to you earlier that it's not only related to just St. Kitts and Nevis. We can recall where a number of states in the U.S., we had Israel recently, would have allowed certain things, and then when you look, because of new infections in large numbers, they went down into full lockdown again. We do not want to go that route, so that's why we are ensuring that we go through this systematic way of educating and ensuring that we continue to narrow the gap in terms of challenges that will come whilst we're preparing for the reopening of our borders. Thank you very much.
Thank you, Superintendent David, for your responses. Jarvis Brown of Vaughan Radio. Just trying to clarify, in terms of the procedure, were there any documents indicating that PCR tests were administered before the 2 COVID cases returned to the island of Nevis? Also, can you give a report as to how both cases are doing? Dr. Judy Nisbet.
Thank you, Mr. Brown. Just to say that the persons prior to travel tested, but as you know, this is one of the reasons why we quarantine persons, because persons can test prior to coming into the Federation, but anywhere along in their travels, they can actually contract COVID-19. And so this is why we continue to test when persons present with symptoms, having traveled, and why we continue to quarantine persons. These persons are doing well. They have mild symptoms, and they continue to improve. Thank you.
Thank you, Dr. Judy Nisbet. Thank you, Mr. Brown, for your question. Shamika Budgeon, it was mentioned last week by Dr. Wilkinson that we will have to coexist with the virus being here in the Federation. Would you then consider this the start of the second wave, or are we still in the first wave? Please explain.
Thank you, Shamika. It's been a while since we had a case of COVID-19 here on Nevis. And because of recent travel, we have had 2 new cases. I would not consider this necessarily the second wave. We will expect our second wave once we open our borders and we have more persons traveling, more free movement of persons. Then is when I would expect that we would see an increase in the number of cases on Nevis. I would not. Our borders are closed. We have control over entry, and therefore I wouldn't describe this as being the second wave at all. Thank you.
Thank you, Dr. Nisbet, for your response. If or when the borders are reopened and there are more cases of the coronavirus, would schools be closed down, or will there be a plan to keep schools open while trying to curb or slow the virus? Ms. Claxton, I guess that question is for you.
Thank you very much for that question. At this point, I am not in a position to respond whether a yes or a no as to whether school will be closed or would remain open. I can say, though, that the relevant stakeholders, including the task force, the health officials, and of course the Ministry of Education, will continue their conversations, and whatever decision is taken will be in the best interest of our staff, our students, parents, and the general community. Thank you.
Of On Radio News, with just roughly a week and a half before October begins, is there a decision as to when the borders will be open? At this point, we do not have a confirmed date as to when the borders will open. So we are waiting for that announcement, and when we get it, I'm sure everyone will be informed and prepare accordingly. So the answer is no at this point. Thank you so much for your questions this evening. I just want to say thank you to all our presenters, Mr. Dyer, Superintendent David, Dr. Nisbet, Mr. Hanley, and Ms. Claxton. And I also want to say thank you to our media houses for joining us each week as we provide these updates. And I want to say thank you to our viewers who join us every week and take the information and use it wisely. I just want to remind persons that you can protect yourself and others by washing your hands, covering your cough and sneeze, avoid touching your eyes, ears, and mouth with unclean hands, disinfect touch areas and surfaces often, practice physical distancing, use a face mask or face covering when in public spaces, and stay home if you're ill. I also want to remind persons of the signs and symptoms suggestive of COVID-19 that include fever, cough, shortness of breath, loss of taste or smell, runny nose, sore throat, etc. And I want to say thank you to the Nevis Disaster Management, Nevis Television, Caribbean Digital Displays Limited, Cornerstone, staff of the Health Promotion Unit, and Task Force members for making these briefings possible. And I am your host, Nadine Carty-Keynes. Please join us again on Mondays at 8:30 p.m. on Nevis Television for the Nevis COVID-19 EOC briefing. Thank you for viewing, and please do stay safe.